Absolutely. So I'm going to be talking about the impact for patients on continuing to have seizures. So I'll be focusing on some of the associated comorbidities that we see with patients with uncontrolled seizures, the things that can affect their lives, their independence, take away their opportunities for education, for employment, their development of social relationships, also things that can be related to trauma or injury from continued having seizures, their increased risk of sudden unexpected death in epilepsy. And one of the most important things that patients will say is their ability to drive and be independent. And so we'll be talking about various concerns that patients have, with driving being one of the top ones. We'll also talk about how even just one seizure in the past 5 years can impact someone's life. And we'll talk about the various implications on their life, not only the things I already mentioned, but also poor health in general, stigma, depression, and so mood disorders, and the other limitations that we talked about, such as employment, education, limitations on driving, and independence. And the idea is that, what is controlled seizures? And some people might say, one seizure every year might be controlled, but it still has impact on patients' lives. So I'll also share just some information about how patients state they feel because of their epilepsy. Again, that isolation, that independence, that learned helplessness or powerlessness. I will focus a little bit on different comorbidities, as mentioned previously, especially depression that we see in a lot of our patients with drug-resistant epilepsy. Also, the burden of many different seizure medications, and also that seizure worry that patients can have. As mentioned previously as well, we will talk about SUDEP. And when we talk about the comorbidities or the impact on patients' lives, it's that fear that any seizure can happen at any time, but it's also that fear of injury and even death. And so talking about SUDEP, we know that SUDEP accounts for approximately 40% of deaths in patients with drug-resistant epilepsy. So we'll talk about some of that as well. And we'll talk about strategies to reduce SUDEP. Some of that is newer medications that have come to the market that may have changes in efficacy that we have seen in the quantum Brody data in the past. Also talk about relationships with surgery and neuromodulation, as well as trying to reduce that risk of SUDEP. And other different technologies that are sometimes used for seizure alert monitors, or there's even something called a SUDEP pillow. But the bottom line is that we know that when someone continues to have seizures, that it impacts their lives, it impacts their mood, their relationships, their opportunities, and it leads to seizure worry. And even patients who say they may be seizure-free for multiple years may say, that fear of that the seizure can come at any time, that unpredictability is sometimes what is most debilitating. But we also know that some of our patients may be on multiple different medications. So we'll also talk about the fact that when you do continue to have seizures, you might have something called a bigger drug load, or you're on more medications. And that can lead to worsened cognition and other adverse events and lower quality of life. So looking for new opportunities for treatment, whether that be a new medication, or again, neuromodulation or surgical opportunities, but opportunities to really try to reduce that drug load while also increasing or maintaining efficacy and overall improving quality of life.